Hello and welcome to the Brain Injury Services Podcast. I'm your host, Donna Meltzer, CEO of Brain Injury Services, or BIS, located in Northern Virginia. If you have listened to our other podcast, well, welcome back. We're glad to have you today. And if this is your first, thank you for joining us today. February is American Heart Month, designated by the American Heart Association and other health organizations to raise awareness about cardiovascular disease, or CVD. CVD is a leading cause of death, and so the American Heart Association and others are encouraging people to learn more about the risks, adopt heart-healthy habits like exercise, healthy eating, and quitting smoking, and support CPR training. The American Heart Association also hosts the National Wear Red Day to highlight women's heart health. That's why I'm wearing a red sweater today to show my support for that really important day. This year, it is happening on Friday, February 6th. So I encourage everyone on February 6th to put on a red shirt, a red sweater, a red tie, whatever it is that works for you and your wardrobe, maybe a red hat and gloves if it's cold outside, and then share your photos on your social media. Did you even know that stroke is a leading cause of brain injury? Don't worry if your answer is no, as many people do not know this. And that's exactly why we are here today having this conversation. With me today are three experts on heart disease, stroke, and brain injury. I'm going to briefly introduce them, and then we're going to dive right in and have a great conversation with them that I guarantee you will be informational and inspiring. With me today are Dr. Mitchell Elkind. He is the American Heart Association's Chief Clinical Science Officer and Senior Staff Science Leader for all association initiatives related to stroke, brain health, and new integrated efforts, including cardiorenal metabolic health. Boy, that's a mouthful, Dr. Elkind, and we look forward to you talking a little bit more about all of those things. As Chief Clinical Science Officer, Dr. Elkind's trusted voice, collaborative approach, and extensive clinical knowledge and experience are instrumental to ensuring the association's next generation research efforts are patient-centered. That's really important, right, Alicia? Highly participatory and inclusive of all populations. Next, we have Dr. Gregory Oshanek, a familiar person to many of you watching today. Dr. Gregory Oshanek, or Dr. O, as we like to call him, and his patients call him, has been the medical director of the Center for Neurorehabilitation Services in Richmond, Virginia since 1991, following a long academic career and many appointments to prestigious universities. Dr. O has also worked closely with the Centers for Disease Control and Prevention, the CDC, and served as president of the board of Brain Injury Association of America. Last, but honestly, most importantly, we have Ms. Alicia Yates with us today. Alicia Yates is a current client here at BIS and a woman who has experienced brain injury as a result of stroke. She is here today to share her story, her advice, and her wisdom so that you, listeners, know what might save your life or the life of others who you know and love. All right, so let's get started and jump in on this great conversation. We're going to talk today in three different segments that we will weave together. We're going to start by talking about what we titled this podcast today, Understanding the Bi-Directional Connection between heart and brain. I'm going to start with you, Dr. Elkind. Can you explain to us what that means? What is this bidirectional connection?
Of course. Well, first of all, let me just thank you, Donna, and your team for inviting me to join you today. This should be really fun. So the heart and the brain are connected in a whole bunch of different ways, but probably with regard to stroke and brain injury, the most important one is the way in which diseases of the heart can lead to blood clots often that can then migrate to the brain and cause stroke. So a very common cause of stroke, as an example, is something called atrial fibrillation, an irregular heartbeat. And people can feel that if they take their own pulse and they feel that it's not beating regularly. That condition goes up pretty dramatically as people age. And again, that can lead, when the heart isn't pumping properly, that can lead to the formation of blood clots within the walls of the heart, and they can then get kicked loose and go up to the brain and cause a significant stroke. And other heart diseases like heart failure and valve disease can similarly connect the heart and the brain in that sort of a bad way. Another major way, though, in which blood vessel disease and heart diseases can cause brain problems is through high blood pressure. So high blood pressure is the most important risk factor for stroke. It also turns out it's a really important risk factor for dementia and cognitive decline as people age. And so addressing high blood pressure can be an important part of maintaining one's brain health. But, all these things talk about how the heart is kind of bad for the brain, and we're really fond of saying what's good for the heart is good for the brain. And I think a lot of people have become increasingly aware of it, though we need to keep pushing that message. But what I like to emphasize is also that this is a bi-directional relationship, meaning it goes both ways, so that we can say also that what's good for the brain is good for the heart. So what do I mean by that? Well, for example, people who have mental health problems like depression, anxiety, substance abuse, they tend not to engage in the healthy factors, the healthy behaviors that we know prevent heart disease. So people who are depressed tend to eat a less healthy diet, don't get enough exercise, they're more likely to smoke, and so forth. And so focusing on what's good for the brain can also be protective for the heart. So again, it really does go both ways.
That's a fantastic explanation. Thank you for that. I think that's something that, pardon the pun, but we can all wrap our brains around, right? Understanding that this goes back and forth. Dr. O, I'm curious, in your practice, what are you seeing as your patients come in to you, particularly, I guess, when they're first time patients? Are you noticing this uptick in connections between brain health and heart health?
Um, yeah, absolutely, Donna. And again, thank you for including me in this discussion. It is clear, as Dr. Elkind has said, 20% of our blood flow goes to our brain. So this is an organ that is really reliant on that pump in our chest. And so anything that disturbs that, anything that alters the efficiency of that is going to alter the efficiency of how our brain works. And whether it is a situation where we have an arrhythmia, whether it's a situation where we have a syncopal episode, we pass out, those are things that interrupt blood flow, and those are things that then cause a lapse, a temporary interruption of the oxygen supply and the glucose supply to our brain. Those are the two vital things that our brains need to function. When that happens, our brains don't work. Under normal circumstances, that's a problem. It becomes mission critical when there's been some sort of an impact, an acceleration, deceleration event, or blunt force trauma to the head, when the metabolic rate of the brain accelerates and the need becomes even greater. If there's an interruption at that point, it becomes magnified. And so if there is any kind of interruption at that point as well, you have even a more devastating outcome. So there's a lot of synergy in the two of those. So in my work with patients, it is always mission critical to find out what was the person's cardiac stance before. Were they exercisers? Were they not exercisers? What were their blood pressure? How well did they take care of themselves in that domain? As well as what's their family history? Sometimes you don't get to pick your parents, unfortunately, and family history plays a big role in a lot of the cardiovascular disease and a lot of the atherosclerosis and cholesterol issues, things of that nature. And a lot of my patients may have issues that, even in spite of themselves, they still have difficulties along those domains. So it has to do with getting a good understanding and feeling for that as well. Because many times, in spite of their best efforts, people still run into difficulties.
Yeah, thank you for sharing that. You're so right. Looking at family history, I think we've probably all watched medicine change over the decades, right? Now, when you go in to see um, your your doctor, not necessarily a specialist, but a general practitioner, they're taking that whole family history and asking you each time you come to update anything that might be changed. What is new? Are you eating well? Are you sleeping? Are you getting exercise? I'd like to think and hope that today we're a little bit more aware that all of these things connect and come together. So thanks for sharing more about how you're looking at your patients and looking at that bi-direction. Alicia, I want to turn to you because this is your life, right? You are somebody who experienced firsthand stroke leading to brain injury. Can you share your story with us? Tell us what happened and how, I'm sure you're sitting here right now reflecting on what Dr. Elkin and Dr. O both just shared. Did you have experiences with your doctors along the way that maybe were leading to some knowledge that something might go wrong in your health at some point?
Un well, you know my story and what I shared with you last week.
Yes, but
Um,
our listeners haven't all heard your story. So give a recap if you would, please.
Both of the doctors have mentioned hypertension.
Mhm.
I was diagnosed at the age of 22, and you, you're a kid. What are you doing with high blood pressure? Unfortunately, when you're getting that diagnosis at 22, you're we're talking 30 years ago, and the we hadn't advanced to where we are now to understand that you shouldn't make a diagnosis based solely on surface. Um, I got diagnosed at 22 because I was overweight, and the assumption was that I was unhealthy. Um, my blood pressure was elevated, was an abnormal event in my life, but my doctor didn't see it that way and immediately put me on medication. This sent me down a road of this basically isn't right. I had medication that was basically I couldn't drive. My mother always had to drive us to work because the medication would put me into sleep and I wasn't going to put us in jeopardy, winding up in a ditch or worse. So over the course of 25 years, I was incons I was consistently inconsistent in not taking the medication and following the protocols. I have been overweight since I was 8 years old. Um, and we're looking at a bi-directional, and I told you I think it's kind of a three-pronged approach because we're kind of missing some things. We're not looking also at how hormones will affect a situation. Um, Especially as we approach February and February 6th, especially as it concerns women. Back when I was diagnosed in 94, um, they had basically just started doing research on how um, women and heart attacks, how it's different for women than men. Most of the studies were on, and I say this with all sincerity, most of the studies are on middle-aged white men, not even middle-aged white women, let alone 20-something-year-old Black women. And there's that disconnect within the medical field that you're going to miss a whole lot of things. Um, in my 20s, yes, depression. Yes, it caused different eating habits. Yeah, hi, my name is Alicia, and I am a not even a reformed junk food junkie. Um, but because when you talk about these types of things, it makes it seem like the person that's all they're eating and that's how they're living. But that's not the reality of the situation. I was explaining to a friend yesterday that I didn't get high blood pressure from what I ate or because I was overweight. Because even though I was overweight, my blood pressure was always, until that time, within normal limits. Um, so it's it's always interesting to hear statistics and um experts, and I always want to know, well, how's your health? Because as doctors, and one of my doctors, I loved him dearly. Um, it's hard when you're a patient to take advice from a doctor who is at least 40 pounds overweight. Um, and
Yeah,
it's
Alicia, I want to interrupt you for one quick
sure.
second here, because I think you said something that was so important. I mean, everything that you're saying is important, but I want to ask Dr. Elkind, you talked about 20 years ago, um, very little research on women in particular, and certainly women of color. So what I'd like to know, Dr. Elkin, is what changes are you seeing from the time period that Alicia is speaking about to now? Are we seeing progress? Are we looking at, as Dr. O talked about, looking into family history, looking at people? Are we starting to see some change in terms of looking at young people and people of various races and different backgrounds?
Yeah, well, first of all, let me just say that Alicia brings up so many really, really important points. One of them that stood out to me is her age when this began. And most people think of stroke as something that only happens to old people at the end of life, some kind of terminal event, but that's not the case. Stroke can happen at any age. We see stroke in children. We see stroke in young women. We particularly see it in people who are younger, who are people of color. So, absolutely right, Alicia. And what we've seen over the last 20 years is actually an increase in stroke in young people. We've seen it go down in old people because we've begun to recognize some of the risk factors I mentioned before, like atrial fibrillation and heart disease and so forth. We've gotten better at treating those kinds of things with blood thinners. But at the same time, we're seeing an increase in obesity, right? 40% of the country is obese, 70% obese or overweight. We see an increase in diabetes and related conditions, and both of those are related to high blood pressure as well. And so, as those risk factors, which are part of this cardiometabolic, kidney, cardiovascular syndrome, we see more of the complications of that can lead to strokes. And so that I think is, a bit frightening. And again, we see this particularly in certain communities of color. People have recognized this problem, and on the research side, there has been more research in that area, specifically to Alicia's point about including women in research. This was a huge oversight, especially in heart disease. Stroke research did a little bit better, but still has a ways to go in terms of including women in the research studies and providing conclusions from research that are applicable to women and people of color as well. So we're seeing improvement, but we certainly have a ways to go. And there are efforts from both the American Heart Association, the NIH, and others to try to increase that sort of research. So thank you for your comments, Alicia. I thought they were right on target.
Right on target. Yes, thank you. And thank you, Dr. Elkin, for weaving back in that piece about the cardiorenal metabolic health. I think we have a little bit of an understanding now about that and how do we need to be looking differently at patients who, have higher levels of maybe some, vascular health issues, AFib, other conditions, which, and again, we're starting to hear more about those things. We hear them on commercials on TV, and so that makes us hopefully all want to learn a little bit more about these conditions. But thank you for sharing about this age spread. So Alicia, maybe this is helpful to you to understand that while you might have felt that you were very young when this happened and it was unique at that time, we now do know that there are many young people who do have stroke, who do have heart disease. Sometimes it might be genetic, sometimes it might be acquired along the way, but I really appreciate what you shared about that. It wasn't your fault, right? But what happened in your story was that the experts, the world really just didn't know so much yet about how to support you along the way in your journey. Can you fast forward with us, Alicia, a little bit? Like, when did you start to get the support that you really needed?
It's a shame I had to have a stroke in order to get the support. And that's really what had to happen. I had to sacrifice myself in order to get well, because Donna knows that I'm third generation stroke survivor. Although stroke did eventually take the life of my grandmother and her second son, my father. Her first son died of heart issues. So cardiovascular and issues and diabetes run through my family, as I was telling Donna the other day, like Usain Bolt. And for a lot of us, you know, some of us have done the things. Like I said, even though I was a junk food junkie, I walked. I mean, exercise was always a part of um, our routine. So what I found out after the stroke, it was a visit to my nephrologist
Hmm.
because there were things that he found out that I was producing too much of the hormone aldosterone. Aldosterone is produced in the adrenal glands. And he found out that my left adrenal gland was producing way more than I needed. And that was probably the underlying cause
Hmm.
to my medication resistant high blood pressure.
Mm.
Um,
I'm going to interrupt you again. I see
Sure.
Dr. O's head going, right? Tell us, Dr. O, is this something that you see in your practice? What can you add to this information about the hormonal and adrenal glands?
Um, it is an all too often problem that individuals get treated by a cookbook method, and individuals do not, to the best of their ability, because of time constraints, things of that nature, people don't do the investigation that is necessary. And unfortunately and sadly, things like this occur. And that's the heartbreaking part, is that uh, healthcare systems don't allow for the investigation that's needed, and that's one of the things that I see time and time again. And Alicia, you end up being kind of a poster child for that kind of oversight, where if there had been a little bit more inquiry, if there hadn't been just look,
Here's a prescription.
yeah, here's a prescription, some uh, assuming that you fit a stereotype, and boom, here you go. Um, Things could have been a different destiny. Um, and that's the part that is difficult. And it's part, these types of discussions that we have in terms of advocacy, in terms of being able to be informed, to go in and talk to your providers. We need to be reaching out to the individuals that are doing the diagnosis, that are doing the boots on the ground, so that things like this don't happen to other Alicias, and can prevent it at that level. So,
Yeah. But let me follow up with you a little bit more, Dr. O, in terms of, we were talking about the bi-direction, right? So Alicia's story begins with her heart, with high blood pressure. Her brain injury came later and as a result of the things she's just been sharing with us. You probably see some of the opposite direction, right? Because people are coming to you because something's going on in their brain. How do you see this trajectory, and how often are you seeing individuals come into your practice with brain injury or concerns about what's going on in their brain that is related to the heart disease or the hormonal issues that Alicia's raising with us today?
I do see it in terms of the whole kind of continuum. Um, Years ago, back in the 80s, the whole idea of the brain injury creating cardiac issues came about in looking at transplant. It was found that in certain severe traumatic brain injuries, there were difficulties in terms of cardiac transplant, because many of the hearts had had subendocardial injuries that made them unsuitable. And it related to, presumably, an excess in terms of adrenaline, in terms of catecholamines that weren't then able to be used. So it was an issue of what was causing that surge. Well, fast forward, we now know that there's a catecholamine surge with a stroke or with a traumatic brain injury. We know that especially with right insular, right deep type of injuries, there is a tendency toward that. And so in some ways, if you've got somebody, for example, with a stroke who has language difficulties, left hemisphere, okay, you don't see that. Right hemisphere, oh, they must be doing okay. Well, no, they're the ones that are more likely to have an elevation in that sympathetic kind of adrenaline surge, and you're going to see more likelihood of those kinds of catecholamine issues. And so in a situation that you see clinically, those are the folks who you might be more suspicious of, or should be more suspicious of. You also then get a whole cascade, whether it's from a stroke or whether it's from a traumatic brain injury that involves those areas of inflammation. and immune response and changes in terms of your gut biome and what your bacteria are in your gut. And because of all of the way of the intricacies of hormone systems and those types of things, and where you are in your cycle, where you are in your age, male, the beauty and the mystery of our brain is overwhelming at this point. And you also then will get abnormalities that can be exaggerated or exacerbated at that point. So in my folks, everything counts. And trying to find a physician that will sit down and listen to all of those different pieces of the puzzle, good luck. Nope, I'll give you 15 minutes for this piece. You've got to go talk to the endocrinologist. I'll give you 15 minutes for that. Nope, I'm sorry, you got to go talk to the nephrologist. Nobody wants to look at the whole picture. And that's part of the fragmented system. And that's where people like you, Alicia, end up getting the short end of the stick. And so with my patients, and in brain injury medicine, as well as in a comprehensive care or a team approach to treating folks like this, you've got to have all hands on deck. You've got to be able to have everybody working simultaneously, which is why you didn't get what you needed until after you had your stroke. Unfortunately, that's when everybody says, oh, this is what we need. And it's unfortunate that people didn't rally to that beforehand.
Right. Sounds like we need more of an interdisciplinary approach. Right. You've just, rattled off a number of different specialists there that when somebody presents with something going on in the heart area, and somebody with the issues with the brain area, really need a whole team to be speaking to them. Dr. Elkind, I want to ask you, this might be a little bit of a segue, I'm not quite sure, but a lot of research is going on these days, right? Which changes maybe how the researchers and the physicians who are meeting with patients hopefully are looking at some of these things that research is showing us, changes to guidelines, really looking at, how these things weave together and present in a patient. Are you seeing any particular studies out there? I know you recently mentioned to me something about a Chinese study that's being done that's looking at recommendations of treatment for high blood pressure as a way to prevent dementia and cognitive decline, which is, could be brain injury. Are studies like that pushing medical practitioners, physicians in new directions?
Yeah, 100%. And I appreciate Dr. O's comments about, this kind of holistic approach,
Mhm.
incorporating, looking at all the different issues that a patient has, bringing in different specialists as needed. And I would just say that the American Heart Association is definitely expanding our focus. So, far from being an organization that's focused only on the heart, and even stroke, which we've done for decades now, we're expanding our interests to what we call brain health as well, which means all the different conditions and factors that can affect the brain. A big chunk of that is because it is cognitive decline and dementia, particularly as people get older, and that's because we have an aging population. We've gotten pretty good at treating heart disease, which means people survive longer, they have heart surgery, they have stents, and so forth. They live to the older ages at which the vascular problems begin to affect the brain. And so, yes, we, for the first time this year in our hypertension guidelines, our guidelines on the prevention and management of high blood pressure, which came out last summer, we said that treating blood pressure was good not only for heart disease and strokes, but actually could prevent cognitive decline and dementia as well. And the reason we took that step and made that recommendation is because there was a very large study in China, as well as others. But I think the straw that kind of broke the camel's back, if you will, was this large study in China that proved that by treating people's blood pressure, there was a lower risk of cognitive decline over 4 years. And so that is really important. We know that dementia, about 40 to 50% of dementia is preventable. We used to think of brain disorders, especially dementia, as just something that happens when people get older, nothing you can do about it, and people didn't really pay attention to it, certainly didn't talk about it in the public sphere. And now we know that, no, that's not true. We can actually prevent a good chunk of dementia. How? By addressing the same vascular risk factors that we do to prevent heart disease. So at the Heart Association, we have something that's simple, So apart from all the complex science, we have what we call life's essential eight. The eight factors, four behaviors that people should know about themselves in order to prevent heart disease, stroke, and dementia. Those are know your numbers. So the four factors are your numbers like blood pressure, blood sugar, cholesterol, and body mass index, a measure of obesity. Know those four numbers. And then four behaviors. They're not going to be a surprise, I don't think, but easy to remember these. Getting enough physical activity or exercise, eating a healthy diet like the Mediterranean diet, obviously don't smoke. That goes without saying, perhaps. And the final one, the eighth one that we added a couple of years ago, is get enough sleep, at least 7 hours of sleep a night, which to a neurologist was super exciting to see that added because what is sleep but a brain related condition? So again, thinking about how what's good for the brain, like sleep, is good for the heart and the rest of the body, a perfect example of it there. So people can look up Life's Essential 8, get all the details on those numbers online at heart.org. But that is an exciting advance, I'd say.
That's very exciting. Thank you for sharing that. I really like how they, have these eight things, four and four. And I think you're right. These are things we're hearing more about today. Alicia, I want to ask you, when you just heard Dr. Elkin talk about these eight things, are these things that your doctors prior to your stroke ever mentioned to you, or things that you are paying attention to now?
Well, because of my family history, I have always, I usually am going in to ask about my blood pressure. My mother had it. Um, my blood sugar. My father had diabetes. Um, my father had high cholesterol. I know my BMI is over 40% and that's a problem. But we're working on that. Um, the only one of these items in this list that I've never ever had a problem with was smoking. I
Well,
was
that's
n-
good.
I was never going to do that. I think it is an absolutely abhorrent hobby. Um, I understand people's addiction to it. Um, but exercise and diet, I've always, like I said, I grew up on a dirt road. It was almost a mile from our dirt road to the state maintained highway. Some days, if there was no car available, if we were going to school, it was a walk. Then there were the walks for fun. Then there were runs, races, things like that, So movement and activity was always a part of my life, and it always was, regardless of what my scale said. Sleep, sleep, that one's always been a little more challenging. Um, I started having anxiety issues, um, as a young child. I was afraid I'd die in my sleep, and so I wouldn't go to sleep. Um, and so, yeah,
Yeah, that's a lot,
Yeah,
especially
it's
on a kid growing up to have to deal with.
and uh, but as we talk about family histories as parents, I always talk to my friends when they have kids. Talk to your kids. Talk to your kids about what's going on in your life. Talk to your kids about how you grew up. The one thing I'd like to tell parents is before your kid ages out of your house and out of your insurance, talk to your primary care doctor or their pediatrician and get them a hormonal panel. Do it when they're young because that's going to help with prevention. That's going to be the biggest thing. If you do it when you're young, you don't have to wait until you have a stroke or post hysterectomy to find out that you were right when you were 25, that you have PCOS, which more than likely caused your diabetes and your CKD.
Thank you for sharing. Those are all such really important things, and I think as a nation we're kind of obsessed with needing sleep these days. There's a lot of conversation about sleep and its impact on the brain. Dr. O, is this something that you are sharing with your patients to talk about the importance of sleep and what we eat and getting the exercise? I mean, this isn't rocket science, as Alicia said, right? But sometimes people need to hear it. It's got to be drilled into them to
Oh,
actually practice these things.
100%. The four cornerstones of recovery and stabilization are sleep, hydration, nutrition, and exercise. And in addition to what Dr. Elkind was saying about the 8 areas, the McCants Center for Brain Health at Mass General adds 4 other things. They talk about alcohol use. They talk about stress level. They talk about your social relationships, and they talk about having meaning in your life. And Alicia was talking about stress, the stress of worrying about, am I going to die in my sleep? Multiple things there. If you're overweight and you're lying on your back and you're having compression, you're more a setup for obstructive sleep apnea. And if you have obstructive sleep apnea and you wake up in the middle of the night gasping, it will appear that you're having a panic attack and you will not sleep as well. And that contributes to everything else. And if you're not sleeping well, if you're not getting adequate N3 sleep, restorative sleep, you'll have problems with attention. You'll have problems with memory. You'll have problems with how fast you think. And consequently, to be able to function during the day, you'll churn out more stress hormone. You'll churn out more cortisol, which will then bump up your blood pressure. It will put more weight around your middle, give you more, metabolic syndrome, things of that nature, and it just feeds on itself. So you've got that factor, and it becomes every one of my patients walking through knows they're going to get a sleep study. It's just check the box. One way or the other, you're getting a sleep study. But the other element is, she's, as she said, she's getting exercise. She's getting exercise, but nothing's changing. That should be a tip off something else is going on. And as she said, looking for other clues, other cues of what else could be going on in a young woman in terms of menstrual irregularities, things of that nature, looking for those hormone changes. But again, many people won't step out of what their designated specialty is. The one area that I do want to make sure that isn't overlooked, and I don't think we're doing it intentionally, people have to have a connection. We have to have a reason. We have to have a why. You know, Alicia has a why. Her why is to making sure that this doesn't happen to somebody else. And so that why, that mission has given a fire in her belly. And to that extent, it also then gives her, the kind of ability to reach out. It gives her cognitive energy. It gives her a whole host of things in terms of connecting and interacting with people. And that has a multiplying effect in terms of our cognitive abilities and in terms of our brain health. Being isolated, living in a cave, doesn't do anything ultimately for either our cardiovascular health or for our brain health.
Hmm. Well said. And Alicia, I know part of the way you kind of dealt with that was by coming to Brain Injury Services, right?
Yeah.
What did coming here after you did have brain injury because of your stroke, how did that change things for you moving forward?
It's a community. And I'm glad Dr. Oshanik brought that up. Um, I was begging people to come visit me in rehab. Um, Not because, I'm afraid of being by myself and none of that, but I know the importance of connection. And I will say that I live in Alexandria, Virginia. I had a stroke in Lynchburg, Virginia. Um, I contacted a cousin who lived in my hometown, which was, I'd say it's about 50 miles away. And I contacted a cousin who lived in Lynchburg because I knew I had the family car. I knew my family couldn't exactly get there. But before 4 o'clock the next day, my sister-in-law was at the hospital with me. The gentleman that was running the seminar that I was at sent another coworker to be with me. So I wasn't alone. Um, and that week I spent in Lynchburg, I remember I was like, I don't remember doing anything outside of drinking water and sleeping. And the cognitive therapist was just quite done with me when I was able to count backwards from 100 by 7 um, fairly quickly. So there was nothing wrong with my brain. I sounded a little funny according to people, but there was there was basically nothing wrong upstairs. Um, when I was transferred to oh great, now I can't remember the name of the place. Woodbine. When I was transferred to Woodbine, somebody visited me every day, and that helped. What I would recommend um, to both of you, Dr. Elkin and Dr. Oshanik, please start looking at rehabilitation as a three-pronged approach. It's not just mind body. Well, it's body, it's the what you're putting in, the medical, the body, the medical, the but don't offer mental health services as an option. It must be part of the protocol. And I'm going to tell you why. Because patients who have had a brain injury or actually any kind of traumatic injury, they're either going to be extremely depressed and barely function, or they're going to be, well, some people will be very, very angry and will not be able to do the things that they felt like they used to be able to do. They'll have forgotten. I know how to, I know how to walk, but because they don't progress, they feel like a failure. And it will take much, much longer. The third thing is that people focus on your ability to walk. When I was in rehab, they focused on my ability to move my lower limbs and not my upper body. They look at your arm and like think fine motor skills, but there's a large muscle in your shoulder, and you need that in order to be balanced. One of the things that they always ask, well, when's the last time you had a fall? Well, there'd be less chance of me falling if I could move my left arm. I'm not, I am not in balance. But it's been about a year since I've had a fall. Um, and it's not because I had a stroke that I fall. It's just the nature of, and I have ADHD. I'm a faller. It's part of my brain moves too fast. So I've got all sorts of issues going on. And I didn't find out about the ADHD until I had the stroke.
This is what I would call like the mic drop moment, right? Alicia, what you have just shared with us and our whole audience who is listening or watching this podcast is so critical. Mental health, upper body, getting good sleep, all of these things are so critical to the success of the recovery. These are the things that Brain Injury Services provides, as well as so many other providers and organizations out there. And your message is just so critically important. I want to, as kind of our final question here, to have each of you share just, in thinking about American Heart Association and Brain Injury Services, we all do advocacy work. We bring our messages like Alicia just brought to us here about what is critically important. So Alicia, you just gave us like three things that need advocacy, that mental health piece. Don't focus just on falls, but it's about the sleep and it's about the nutrition and rehabilitation for upper body and lower body. Um, but Dr. O and Dr. Elkind, I'd like you each to share as well what you think that we all need to be advocating for as well, or you see, what is it that your patients need that we should be shouting out about, in particular as we have, Heart Month coming up, and then right after that we have Brain Injury Awareness Month. What are those unified messages that we need to be talking about? Let me start with you, Dr. O.
Oh, great. Thanks. I was going to have Dr. Elkin go first, but okay.
Well, we can go in that direction if you'd like.
That's okay. Unfortunately, I think what's happened in the country is we have oversimplified things. And as Alicia just said very clearly, if you can walk, you're fine. If you can subtract, you're fine. I tell my patients all the time that there are carpenters that are framers. There are carpenters that do finish work. There are carpenters who do parquetry. And each of those carpenters have a role in terms of building a house. And unfortunately, what we have allowed to happen in terms of the care of patients, especially in terms of rehabilitation, is we have allowed the rehabilitation to stop in terms of conceptually, in terms of framing. And so when you can walk 100 feet unassisted, you're framed, you can be discharged, you're fine. And we need to push for individuals to be able to get the additional cabinet work, the additional flooring work, the additional finish work that they need. And that's not to say that the therapists, the OTs, PTs, and speech that are doing this are bad. It's just that they're doing the foundational work. They're not finishing the job. And as a consequence, the morbidity, the disability that is occurring is increasing. So, as I said in front of Congress a couple of years ago, if you're not going to fund the rest of things, should you even fund the start of it? Or are we just abandoning people after we've given them false hope? Got some really ugly looks with that.
Yeah, I bet you did.
But the
But
point,
brilliant.
but the point being, you've got to see it through.
Yeah. Well, and that's why Brain Injury Services is here, along with um, 7 other brain injury service providers across the Commonwealth. We are very fortunate in the state of Virginia to be able to take those next steps. That's how Alicia came to us, right? She couldn't get everything she needed in the medical setting, but then people come to us after the medical setting has finished what it's doing and they can come here to carry forward. So great message. Thank you. Dr. Elkind, what are your thoughts? What else do we need to advocate for?
Oh, this has been a great conversation, and I've learned so much from my colleagues here. I think from Alicia, I learned a tremendous amount about the importance of community, and I couldn't agree more. And from Dr. O, I learned a lot about carpentry, so I appreciate that. Thank you very much. Um, I would say, the way I think about this, reflecting on what we've talked about here, I sum it up kind of as saying that the brain exists in the body and a person exists in society or community, perhaps. And by that, I mean, we can't think of the brain as this organ that's just, located in the skull. It's protected by the skull and by this blood-brain barrier that we always talk about, so it doesn't communicate with the rest of the body, and we study it in isolation. The fact is, the brain is intimately connected, certainly with the heart, as we talked about at the beginning, but also with the lungs, the kidneys, the immune system, the gut, right? We hear a lot about the microbiome, the gut-brain axis. So the brain is part of an organism, and we need to study it and think about it in that way. And similarly, a person exists in society, meaning that we know that only 20% of healthcare outcomes, meaning how people do if they have a medical condition, takes place in the doctor's office or the healthcare system. The other 80% of it is related to what's going on in their community, in their environment. Just as Alicia said, it's based on, do you have safe and secure housing? Do you have a neighborhood where you can walk around? Do you have clean air, safe water, and so forth? Those are the things that truly drive health. And so we at the Heart Association have kind of doubled down on looking into those factors, investing in research around both the relationship of the brain to the rest of the body and the relation of the individual to their family, to their society, and to the nation at large. And how can we improve the conditions that would improve health? Because that's where health resides primarily. So in terms of advocacy, I think that means advocating for those conditions, advocating for research, certainly on these connections between the brain and the rest of the body. And we're investing in that at the Heart Association as part of our research funding initiatives. Would love to see the federal government continue that as well. And also the importance of these kind of social conditions, social drivers. And I think a great one where we see a lot of focus, a lot of potential for focused activity in the near future is around nutrition. Right? It's around getting healthy food to people because there's evidence that that improves their cardiac health, their brain health, and so many other things as well. And so this food is medicine idea is one that we're very heavily invested in as well. And we're advocating for even more of that in the future. So those would be the areas I would focus on. But again, thanks so much to all of you for inviting me to participate.
Thank you all. What great advocacy information. Thank you for those great ideas, all really important. And I want to thank each of you for joining us today for this really important conversation. Alicia, thank you for sharing your very personal story with everyone. I think that it will lead to a lot of great thinking for people about how they take better care of themselves and push to get the support and the medical attention and beyond that they need. Dr. O, Dr. Elkind, thank you for sharing your expertise with us today. I want to remind our listeners and those watching, if you're looking for more information, you can go to heart.org for more information about heart health and heart issues. Please wear red on February 6th, take photos and share. And of course, if you want to know more about brain injury services and brain injury, please contact us at braininjurysvcs.org at any time. And Dr. O, we have your information up on our screen here as well for anybody who needs to connect with you and learn more about brain injury from your clinical perspective. Thank you all again for being with us, and I wish everybody a great rest of your day.
Thank you very much.
Yeah.
Pleasure.